All right, this is a continuation of our examination of the service sector, and we're going to focus specifically upon healthcare because it is a big contributor to GDP that needs fixing. I believe it needs fixing badly in the United States. So this chart shows how out of whack the United States healthcare is compared to other industrial nations. Right? There are 14 industrial nations listed here: USA, Netherlands, France, Germany, Canada, Switzerland, Denmark, New Zealand, Sweden, UK, Japan, Norway, and Australia. All right. So you can see that the vast majority are bunched up in a tight group, except one outlier, way above the rest, is USA, which means we have a very costly and expensive healthcare system. Does that mean it's good? Well, we'll see in a second. So here's the caveat. This in no way is intended to be a detailed analysis of the U.S. healthcare system. It is simply a general overview of some of the obvious aspects, some of the obvious problems. High cost, poor quality, poor market conditions, corrupt nature of healthcare allowed by poor market conditions. So, a key reason why healthcare is such a high proportion of U.S. GDP is because it's way overpriced. Forbes magazine 2013 did a study of healthcare systems, top 11 industrialized nations, and UK's healthcare system was ranked number one, while the USA's healthcare system was ranked at the bottom at number 11. 11 out of 11. Yet USA's healthcare system was a cost list at 2.5 times more expensive per capita than United Kingdom. So per capita, over twice as expensive. It's out of control. And I believe the fundamental reason why U.S. healthcare costs is so exorbitantly high is the poor competitive nature of the healthcare market, largely due to two key factors. One, lack of consumer patient information, information on medical knowledge, disease pathologies, treatment options, prices. Right? You go to the hospital, you don't get a list of prices to pick and choose from. Right? They just do whatever, and then they bill you later. Right? And two, choice. You lack choice. You lack choice on your diagnosis. I mean, multiple doctors will give multiple different diagnoses. Right? You lack choice on treatment selection. You have lack choice on medical device selection. All right? They're going to pick the most expensive, the one that pays them the best. Whether or not it's optimal treatment. You have no choice for price comparison. You have no choice over treatment locations, whether it's in hospital or out of hospital, off site, or even different hospitals. And you have no choice, for example, of things like out of network providers. In fact, you don't even know that some of your providers are out of network until you're whacked with a big bill. All right. So let's say you go in for surgery. Well, your insurance covers everything but the cost for the anesthesiologist. Right. He's out of network. Right. But you didn't know that. So you're hit with an unexpected bill for another 25 or 30 grand. Right. Boom. Straight out of pocket. You got to pay. This disadvantage creates a myriad of opportunities for corrupt and inefficient practices at all levels. I'm going to do this lecture. I'm going to go through all the corrupt practices, right? The different ways the healthcare providers screw the public to maximize their profits, from executives of healthcare management organizations to hospital executives, profit maximizing consultants, right? Insurance company executives, and individual practitioners, individual doctors or whatever, dentists or whatever. What they do to squeeze out the maximum amount of money for themselves, right? Which is not in your interest as far as patient outcomes, right? So I plan to do a lecture on that, lecture series. Uh, One problem is that the U.S. healthcare is that in U.S. healthcare, the ratio of administrators to healthcare providers has grown to excessively disproportionate levels. I mean, this is top heavy. To me, this is a lot of waste. Right? You're paying all these managers, right? You should trim this. All right, so these are the healthcare providers down here in yellow. These are physicians. These are managers. There's way too many managers. All right, it's a waste of money. So a goal of healthcare corporate executives. Well, okay. Furthermore, in the U.S. system, the big money makers are not the doctors, but rather the corporate executives. These are the guys that make the big money, not doctors. You think of doctors as being, big money makers. Well, that's nothing compared to the corporate executives. And their chief goal is maximizing profits above patient care and outcomes. To them, it is a business, first and foremost. Right? It's about maximizing profits and bonuses for themselves. But at the same time, maintaining nonprofit tax-free status. For example, typically hospitals have tax-free status because they are designated as nonprofit organizations. And while that makes hospitals sound like they're charitable organizations, they are anything but. Hospitals are pure business, which means pure profits. Right? However, any income above operation costs is doled out in exorbitant salaries and bonuses to corporate executives so that the books show zero profit margin. Right? Any excess money you pull in, you dole it out in big bonuses for the corporate execs. Right? Then you can say we're nonprofit. We are not showing any profit. Because salaries are part of your operating costs. Thus, they pay no taxes. That's screwed. They get a big government benefit. They get a big, ride for free. Right? For no reason. They're not really nonprofit. There is a separation between financial reward and patient care. In other words, patient outcomes does not necessarily drive monetary reward. So this is inefficient in terms of product quality over price. Right? Now, the impact of high U.S. healthcare costs include expensive premiums and co-pays for the public. You're paying a lot more than other countries. Right? You shouldn't be happy about that. High input costs for U.S. companies, undermining their international competitiveness, and as a result, encouraging exported jobs overseas. Well, that's not good for Americans. Finally, I believe it is a general drag upon the U.S. economy to the extent that the high cost of healthcare siphons away money that is better spent upon developing innovative technologies, products, and services which will grow the economy. Right? You're just flushing it down the drain in healthcare with excessive unnecessary costs. These companies should be investing in innovation because that's what drives economic growth. Principles for fixing U.S. healthcare, I'll save for later. But I mean, there's the general principles are you want it market-based. Right? As much as possible, you want it market-based. You want it incentivized, based upon incentives. Right? But at the same time, you want to take out major profit-changing potential in the choice of diagnoses, treatment selections, equipment usage, right? Coding, all that bullshit, which these healthcare organizations basically fudge and scam and cheat to maximize their profits, right? So there's problems. We're way up here, right? This makes us less competitive economically. It's a drag on our society. It's a drag in our economy. And we're ranked low in healthcare quality. All right. So that's that.